So my name's Natalie. I'm a physiotherapist. My role at the moment is clinical lead for out of hospital therapies, but it's mainly working in the community from a physio point of view rather than a leadership point of view. It's mainly working in the community with patients in their own homes. So physiotherapy is massive. So what I think most people imagine is those physios working at the side of a pitch, running on a pitch with their bag, treating a sporting injury. That is one part of physiotherapy, but it's such a small part of physiotherapy. So what we do is we help people who have been affected by an injury, an illness, a disability, and the main ways in which we help them are through movement, exercise, manual therapy, education and advice. They're sort of the main, in a nutshell, treatment options that we use. We work with people of all ages, so right from newborn babies all the way up to end of life. There are three broad areas of physiotherapy. So you've got musculoskeletal, which is your stereotypical working with people who've, injured their back, knee, shoulder, that type of thing, where they go in, people would go into an outpatient clinic and have treatment. You've then got your area of respiratory, which I think is probably the least well-known area of physiotherapy. So we work with people after they've had major surgery. We work with people on intensive care, helping them to maintain their airways. You've then got the element of people who have cystic fibrosis, who need that sort of manual therapy on their lungs regularly to help keep their chest clear. So that's an area of physiotherapy people are not always aware of. And then there is the area of neurology, which is the area that I mainly used to work in, which is so people who've maybe had a stroke, or who've had a head injury, or who have a progressive disease like multiple sclerosis or Parkinson's disease, and it's working with them to enable them to be as independent as they possibly can, to regain movement and so function. And when I say function, I mean it's quite often working quite closely with occupational therapists, so that they're using the movement and the strength they may have gained to be able to go into the kitchen and do things for themselves, or to be able to walk that bit further. We very much work with patients at the centre, so working on what matters the most to the patient, and then sort of working on aims and targets based on what the patient wants to achieve. So yes, so as well as being a physio working with patients and people, you can work in education, you can work in research, and you can work in service management, which is a direction that I've started to go in myself now. A day in the life of a physio is so varied. I don't think you would ever have 2 days that look the same. The people that you work with are different. The team members that you work with are so varied, from occupational therapists through to the doctors, the nurses. We have assistants that work very closely with us and help us with our work. So yes, at the minute, patient caseload wise, I've got people that I'm working with in their own home whose balance, their balance isn't great through a number of reasons, and trying to help keep them as safe as possible, and to do exercises to help promote their independence. I've also got a very young man on caseload at the minute who comes into our gym. He had a spinal injury, so we're actually working on trying to get him walking again. So it's so varied. How did I get into my profession? I have to say, I probably was going in for that stereotypical role at the beginning. I was very sporty, very active when I was young, and I thought, yes, I'm going to go in and I'm going to be, a physio that works with people who've had sporting injuries. But actually, when you do your degree, that's such a small element of it that it opened my eyes as to what was out there. And I went into the NHS and did my rotations in all of the areas as a junior. And the area that I really loved was working in neurology, because I just found it really rewarding. So people who've had this massive change, they'd had a stroke, had this massive change to their abilities, to then be able to work with them to regain some of what they'd lost. And it was just so rewarding, and I really enjoyed it. And then yeah, my path is, I then moved on to working in the community, and I've now moved into a leadership role. How you get into physiotherapy, it is a degree. You do need a degree. The way I had to do it was through A levels and then went on to university. There are other options now. We currently have some of our assistants who are doing an apprenticeship, so they're being supported to get their physiotherapy degree whilst they're working. So there's lots of different options now for people to get into the career. And would I recommend this job to others? Absolutely. I love my job. I love how varied it is. I've loved every one of my roles working through over the years. It's offered me flexibility when I've needed it for having a family, and then I've been able to grow and develop after coming back to work after having my family as well. So yes, absolutely, would definitely recommend it as a career.
That's amazing. Thank you so much, Natalie.